Hey, pet parents. Today, I want to talk about something that comes up constantly with dogs who have just been diagnosed with valley fever, especially dogs who have just started fluconazole. And that is this: your dog will not eat. Not my dog is being picky, not my dog is just being stubborn, not I left the kibble out and I guess they'll eat when they're hungry. No, these dogs are sick. They feel awful. And when a dog with valley fever stops eating, that is not a small problem. That is a big red flag that your dog needs support. I see this all the time in my Canine Valley Fever Facebook group. A dog gets diagnosed, the vet starts fluconazole. The dog already had a puny appetite because they were sick. And then after starting the fluconazole, the appetite completely tanks. Now the pet parent is panicking because the dog will not eat, will not take the pills, has no energy, and everyone is afraid because the dog needs the medication to get better. But the medication seems to be making the dog feel even worse. So let's talk about what is actually happening, because this is not just an appetite problem. This is usually a valley fever problem, a pain problem, a fever problem, a gut problem, a fluconazole side effect problem, and an immune system problem, all happening at the same time. First, we have to remember what valley fever is doing to the body. Valley fever is not just a little cough, it's not just a mild respiratory infection. For a lot of dogs, valley fever feels like a horrendous flu that just does not go away. These dogs feel like absolute garbage. They're tired, they're weak, they may have a fever, they are painful. They may have inflammation in the lungs. They may already have infection spreading into the bones or joints or lymph nodes, eyes, nervous system, or other parts of the body. So when people say, my dog just doesn't want to eat, I want you to understand that your dog may feel like they have been hit by a truck. And when you feel that bad, appetite disappears. The second piece is pain. Valley fever is painful, 100%. If it starts in the lungs and there is lung inflammation, there may be coughing, there is chest discomfort, there may be difficulty breathing. That is extremely uncomfortable. In fact, it's painful. And if valley fever has moved into the bones or joints, that is painful and even excruciating also. Chest pain is no joke. Bone pain is no joke. Joint pain is no joke. These dogs may not cry. They may not scream. They may not limp dramatically at first. They may just lie there, look sad, avoid food, and not want to move. Pain suppresses appetite every time. So if your valley fever dog is not eating, one of the first questions I want you to ask is not, what appetite stimulant can I give? The first question is my dog painful? Because if your dog is painful and you just throw an appetite stimulant at them, you have not solved the actual problem. You have just added another drug on top of a dog who is already overwhelmed. The third piece is fever. Fever is common with infections, including valley fever. Fever is not always bad. Fever is part of the immune response. The body heats up because it is trying to fight the infection. And in some ways, fever is the body saying, I know there is an invader here, and I am responding. So I do not automatically panic about every fever. I do not automatically want to crush every fever. But fever can absolutely make dogs feel miserable. Fever can make them lethargic. Fever can make them nauseous. Fever can make food smell disgusting. Fever can make a dog who already feels terrible say, absolutely not. I am not eating that. So again, the answer is not always add an appetite stimulant. The answer is to look at why the appetite is gone. Is it the valley fever itself? Is it pain? Is it fever? Is it nausea? Is it the fluconazole? Is it all of the above? Very often it is all of the above. Now let's talk about fluconazole because this is where a lot of pet parents get stuck. Fluconazole is the most common drug used for valley fever. In many cases, these dogs need an antifungal medication because they are very sick and valley fever can be life-threatening. So I'm not saying do not use fluconazole. That is not the point. The point is that fluconazole can be hard on some dogs. Some dogs tolerate it beautifully. Other dogs start it and suddenly their appetite crashes. They may have nausea. They may have stomach cramps. They may vomit. They may have diarrhea. They may have a sour stomach. They may act like food is offensive. They may walk up to the bowl, sniff it, turn away, and look at you like, I cannot do this. And then everyone is stuck in this awful loop. The dog needs treatment for valley fever, but the treatment is making the dog not eat. And if the dog does not eat, the dog cannot heal because food is not optional here. These dogs need calories. They need protein. They need hydration. They need nutrients. They need the raw materials to rebuild tissue, support the immune system, tolerate medication, and survive this infection. If they are not eating, we cannot just shrug and say, well, they'll eat when they're hungry. That advice might be fine for a healthy dog who is holding out for chicken nuggets, but it is terrible advice for a sick valley fever dog. A sick dog is not a spoiled dog. A nauseous dog is not a stubborn dog. A painful dog is not manipulating you. A dog with valley fever who refuses food is not being dramatic. They are telling you something is wrong. So what happens conventionally? A lot of time the pet parent calls their vet and they say, my dog is not eating. And the answer is, okay, let's add mirtazapine, or let's add Entice, or some other appetite stimulant. And I am not saying there is never a place for appetite stimulants. Sometimes in a crisis, you need to get food into the dog. Sometimes you need a bridge. Sometimes you need emergency support. But my issue is when that becomes the whole plan. Because if the dog is not eating because they are painful, nauseous, feverish, inflamed, microbiome damaged, exhausted, and overwhelmed from valley fever and fluconazole, simply forcing appetite with another pharmaceutical does not address the root problem. It's like putting your foot on the gas when the engine is smoking. So instead of asking, how do I make my dog eat? I want you to ask, why is my dog not eating? And that changes everything. The first thing I want to know is whether pain is being addressed. And when I say pain management, I am not only talking about pharmaceutical pain medication. In conventional practice, a dog may be given something like carprofen or Rimadyl, gabapentin, prednisone, or another pain or anti-inflammatory medication. And again, there may be cases where those are used, especially in a crisis. But we also have to be thoughtful because these drugs can affect the gut, the liver, the kidneys, the microbiome, and the immune system. And when we are dealing with a fungal infection, I am always thinking about the immune system and the whole dog. In my world, pain support is bigger than just reaching for another drug. I use homeopathic pain remedies. I use herbal pain formulas. I use manual techniques like massage, acupressure, acupuncture, and physical therapy strategies. I use environmental and physical strategies. Sometimes just getting the dog outside in the fresh air and sunshine can help. And I know that sounds simple, but it matters. Fresh air, sunlight, gentle movement, and a change of environment can stimulate the nervous system, improve mood, support immune function, and sometimes reduce that shutdown response where the dog just lies there feeling awful. I also love modalities like laser therapy, red light therapy, pulsed electromagnetic frequency, or PEMF. These can help with pain, inflammation, circulation, tissue healing, and comfort. And they can be incredibly helpful tools in a multi-pronged plan. So if your dog is not eating and nobody has assessed pain, start there. The second thing that I want to think about is nausea and gut damage. Fluconazole disrupts the gut. It can irritate the digestive tract. It can contribute to nausea, cramping, vomiting, diarrhea, and appetite loss. It also disrupts the microbiome. And that matters because the gut and the immune system are deeply connected. When we destroy the microbiome or fail to support it, the dog may have a harder time tolerating medication or digesting food or absorbing nutrients and mounting a healthy immune response. So gut support is not optional, in my opinion. It is part of the valley fever plan. This is where fresh food can make a huge difference. A lot of people keep offering the same dry kibble or canned food, and the dog keeps refusing it. They leave it out all day and hope the dog will eventually give in. But kibble is dry. It's high heat processed. It gets rancid a week after you open the bag. It is not appealing to a nauseous dog or really any dog. It does not have the moisture content these dogs need. And for a dog who feels terrible, a bowl of dry pellets may be the least tempting thing on earth. So instead of asking, why won't my dog eat this kibble? Ask, what would actually be appealing and nourishing to a sick dog? Warm food usually works better than cold food. Moist food usually works better than dry food. Fresh food definitely works better than processed food. Strong smelling, high value food usually works better than bland, rancid little pellets sitting in a bowl. This does not mean you have to create a perfect gourmet balanced diet overnight while your dog is in a crisis. But it does mean that you need to stop expecting your dog to eat food that is not working. So warm cooked chicken, give scrambled egg, turkey, beef, sardines, warm bone broth, a simple homemade diet, or a fresh, balanced, fresh food recipe, or maybe a little bit of the right topper. These can be the difference between a dog eating and not eating. Bone broth can be really easy and really helpful as long as it's pet safe with no onion. But warm broth can add moisture, aroma, minerals, collagen, and gut support. Sometimes you can pour warm broth over food and suddenly the dog is interested again. I also think about probiotics and digestive enzymes. These are core supplements for any sick dog. And when a dog is on long-term antifungal medication and has a poor appetite or digestive upset, I am thinking very seriously about supporting the gut. Now, sometimes we have to talk about the fluconazole dose. This is not something I want pet parents adjusting casually on their own. Do not just change your dog's medication dose without talking to your vet. Valley fever can be serious, and undertreating it can be dangerous. But I will say this. In some dogs, if the appetite is completely crashed after starting fluconazole, sometimes we have to temporarily reduce the dose so the dog can tolerate it, get the appetite back, get the gut supported, and then work back up toward the recommended dose. That decision needs to be made thoughtfully. It depends on how sick the dog is, where the valley fever is in the body, what the titer is looking like, what the blood work is doing, what symptoms the dog has, whether the dog has liver enzyme elevation, whether there is neurological disease or bone disease, lung disease, or other complications where you are using antifungal medications, or whether you are using antifungal herbs to fill the gap. But the point is this: if the dog cannot eat, you do not have a successful treatment plan. A perfect dose on paper does not help if the dog is melting down in real life. This is one of the reasons I wrote the book, Conquering Valley Fever, a tactical guide for dogs and their humans. Ooh, let me get you a QR code for that. And I'll show you my book. Oh, it's on the other side. All right. This is my book, Conquering Valley Fever, a tactical guide for dogs and their humans. And I wrote it for you because I get a lot of questions about valley fever dogs or dogs with valley fever. Valley fever causes serious issues. And the pet parent is told, here is fluconazole, come back in a few months. But the dog will not eat, has diarrhea, is painful, is exhausted, and the family is panicking. That is where we need to step back and build a better support plan. So I outline my integrative support plan for dogs suffering with valley fever in my book. You can get it on Amazon, or you can go to the link here, the QR code, and get an instant download of my book. The third thing I think about is immune support and antifungal support beyond fluconazole. So fluconazole is fungistatic, which means it inhibits fungal growth. It does not kill the fungus. Your dog's immune system still has to do a tremendous amount of work. That is why I care so much about food, gut health, inflammation, pain, fever, hydration, and herbal support. So this is also where I use my canine valley fever support tincture. The goal is not just kill the fungus. The goal is to support the dog while the body fights this infection. In my formula, I have herbs that support the immune response, herbs that are antifungal, in fact, herbs that are fungicidal, they actually kill the fungus, herbs that help with inflammation and pain, herbs that are antioxidant, herbs that help with coughing, and there are even herbs in there that will help bring a fever down. And again, fever is not always the enemy, but when a fever is making the dog miserable and not eating, we need to support the dog through that process. Ooh, let me see if I can find my tincture. There it is. There's a link to my tincture. So this is where integrative medicine shines, because we are not only looking at medication, we are looking at the whole dog. Is the dog eating, drinking, sleeping, moving, coughing, painful, feverish, nauseous, losing weight, having diarrhea, vomiting, breathing comfortably? Is the dog mentally present? Is the dog improving or declining? Is the current treatment plan helping the dog tolerate treatment? Or is the plan technically correct but failing the actual patient? That distinction matters. Now, let's talk about practical food strategies, because this is what most people desperately need. First, stop feeding dry kibble. Stop leaving dry kibble out all day and hoping for the best. That is not a plan for a sick valley fever dog, or any dog for that matter. Food sitting out gets stale and is likely rancid. The smell changes, it becomes even less appealing, and it may be toxic. And every time the dog walks past it and refuses it, you feel more panicked and the dog may become more food averse. Dogs know when food is bad, but sometimes that's all that's offered and they have no choice. So give them a better choice. Offer small, warm, fresh meals. Do not overwhelm the dog with a huge bowl. A nauseous dog may look at a big pile of food and walk away. Start with a small amount. Make it smell good. Warm it slightly. Sit with them. Be calm. Do not hover and panic. Do not shove the bowl in their face 20 times. Offer something appealing and give them a chance. Try warm cooked chicken. Try a little scrambled egg. Try lean ground turkey. Try fresh cooked food with bone broth. Try a commercial gently cooked food if you do not have homemade ready. Try using food toppers. Sometimes a tiny amount of something delicious on top is enough to get the dog started. And then there is one trick I learned from another holistic veterinarian that is almost ridiculous, but it can work. So you get a boneless pork chop, you saute it in real butter, let it cool down a little, cut it into pieces, and offer a few bites to your dog. Now, obviously, this is not the long-term diet. This is not the balanced valley fever meal plan. This is not what I'm telling you to feed forever. This is an emergency. Can we wake up the appetite trick? The smell of pork cooked in butter can be very tempting. For some dogs, once they take those first few bites, the appetite starts to come back online. Then you can transition into more balanced, supportive food. The goal is not to create a picky dog. The goal is to get a sick dog eating. There's a big difference. And remember hydration. Dogs who are not eating are often not taking in enough moisture. If they're vomiting or having diarrhea, they can become dehydrated. So warm broth, moist food, and veterinary care when needed are all important. If your dog is weak, collapsing, breathing hard, vomiting repeatedly, has bloody diarrhea, can't keep medication down, has pale gums, seems disoriented, has seizures, or has not eaten for more than a day or two, depending on their size, that can become urgent. Don't sit on that. Get help. Go to your vet or go to a veterinary ER or urgent care. Now, I know some people are thinking, but what if my vet just wants to add more drugs? This is where you have to advocate for your dog. Ask better questions. Could my dog be painful? Could my dog be nauseous from fluconazole? Could the dose need to be adjusted temporarily? Should we check liver values? Should we support the gut? Should we change the food? Should we use anti-nausea support instead of only appetite stimulation? Should we consider whether the valley fever is disseminated or spread throughout the body? Should we recheck blood work? Should we evaluate for bone pain? Should we do chest x-rays? Should we look deeper? The answer is not always just add entice or just add mirtazapine. The answer is certainly not just wait and see if they eventually eat kibble. These dogs need a plan. And I want you to understand that when your valley fever dog will not eat, you are not being dramatic by worrying. You should worry, not in a panic spiral, but in a productive way. Appetite is a vital sign. Food intake matters. Weight matters. Hydration matters. Comfort matters. So here is the big picture. If your dog suffering with valley fever recently started fluconazole and now will not eat, do not assume they are picky. Assume they need help. They may feel sick from the valley fever itself. They may be painful. They may have a fever. They may be nauseous from fluconazole. Their gut is likely irritated. Their microbiome is disrupted. They may be overwhelmed, inflamed, and exhausted. So we support the dog from multiple angles. We manage pain. We support the gut. We feed real, warm, appealing food. We use bone broth, probiotics, digestive enzymes, and fresh food. We talk to the veterinarian about whether the fluconazole dose needs adjustment instead of letting the dog crash. We consider integrative tools like herbs, homeopathy, laser, PEMF, massage, acupressure, fresh air and sunshine, and gentle movement. We support the immune system because the immune system has to fight this fungus. And we stop pretending that a bowl of kibble left on the floor is enough for a dog battling valley fever. It's not about being fancy. It's about survival. A dog with valley fever who eats has a better chance to tolerate medication, maintain weight, rebuild strength, and fight the infection. A dog suffering with valley fever who does not eat is in trouble. So if this is your dog, please do not wait until things are desperate. Get support early. Talk to your vet. Ask about pain. Ask about nausea. Ask about the fluconazole dose. Ask about blood work. Ask about food. Ask about gut support. And if you want an integrative plan that looks at the whole dog instead of just piling one pharmaceutical on top of another, that's exactly what I help pet parents do. So I actually have an online DIY integrative valley fever treatment program, and it's called Rescue Your Dog from Valley Fever. Let me find a QR code for that. So I go into all the details about conventional treatment and holistic treatment options in this online program, because the goal is not just to get your dog onto fluconazole. The goal is to help your dog survive valley fever, tolerate treatment, eat, heal, and get their life back. And sometimes the most important thing we can do is stop asking, how do I force my dog to eat? And start asking, why does my dog feel so awful that they cannot eat? This is where the real solution begins. So if you're overwhelmed and your dog is in bad shape, take them to your vet. But also schedule a telehealth consult with me and I will put an action plan together for you. You don't have to do this alone. Let me get you a QR code. Neither does your dog. Your dog doesn't need to do this alone either. So until next week, Keep advocating for your dog. And I will be back next week with more information about treating dogs with valley fever. Another common issue I see a lot in my Canine Valley Fever Facebook group. All right, so I hope this helps. If you know someone with a dog with valley fever that could benefit, share this video with them. And I'll see you later.